So coming out of clinical training, it occurred to me that I was going to dive into trying to use this approach, and it occurred to me to work on a common disease of major importance to public health worldwide. And the disease I chose to focus on was hypertension. And the reason I was particularly struck by hypertension is, first, its prevalence. It affects more than 1 billion people worldwide. This is a major disorder around the globe. And second, it's a major contributor to the leading and third leading cause of death in the United States and worldwide, namely heart attack and stroke. And collectively, there are more than 13 million heart attacks and strokes that result in death every year around the world. The treatment of hypertension is far from optimal, and importantly, its pathogenesis has been largely unknown and hotly debated. We set about to scour the planet, looking for the people with the very highest and very lowest blood pressures on the planet, and then studied their families to look for whether there are other people in their families in whom the trait recurred in a similar way. And we've recruited over the last 20 years about 10,000 people from literally every continent and most countries around the world, where the increasing connectedness of the world has brought rare patients with extreme phenotypes to medical attention, and they find their way to our laboratory. And so the first example that I'll give you of this is a family shown here, and the filled symbols are individuals who were diagnosed with hypertension before the age of 10, which is a trait that is extraordinarily rare in the general population. And that suggested that this family might have a single gene disorder. And we then compared the inheritance of every segment of every chromosome to the inheritance of this extreme form of hypertension in the family, and ultimately identified the underlying gene. And we've done this on a number of occasions, and have identified results of the sort shown here, where we identified a single gene form of hypertension that was caused by a mutation in a sodium channel in the kidney, and we demonstrated the molecular mechanism of that mutation is that it causes this sodium channel to no longer be able to be turned off by its normal regulatory pathway. And as a consequence, this channel remains on the cell surface, remains active, and the kidney reabsorbs more salt. And as it reabsorbs more salt, water follows to maintain the serum osmolarity and the serum sodium level at precisely 140 millimolar concentration in the blood. And at the expense of doing that, plasma volume has expanded. This causes increased blood to be returned to the heart, and the heart is an obliging pump, and when it works normally, it'll pump out essentially whatever is delivered to it. And so as it pumps out more blood, by Ohm's law, blood pressure goes up because E equals IR. If you pump more blood into the vessels, the pressure inside the vessels will rise. Well, we did this experiment repeatedly by identifying these rare families from around the world, and identified many genes that led to high blood pressure. We did the opposite as well. We identified mutations that caused hypotension or low blood pressure in the first days of life that landed children in the neonatal intensive care units. And among the syndromes that we studied was one that we demonstrated was caused, instead of by gain-of-function mutation in this sodium channel, loss-of-function mutations in the same sodium channel.